Hello, everyone. Welcome to Lump Basics, or the Lump TCM and Acupuncture series for the beginners. And this is now episode 54, and welcome. So we start the session with the first presentation by Ma'am Lynn Galarita of Quezon City. Ma'am Lynn, good afternoon.
Good afternoon, Dr. Hector. Good afternoon, everyone. For today, we have a new topic, diagnosis by palpation. This is a very important and very interesting topic. So what is palpation? Diagnosis through palpation is generally by feeling, which includes the following: palpation of the pulse, palpation of the skin, palpation of the limbs, of the hands, of the chest, of the abdomen, and palpation of the different points. Okay. So, among the very basic for TCM practitioners is pulse diagnosis, and this really involves pulse palpation. So here we have 28 different pulse qualities. In general, these are grouped into 6 at the yin-yang level. So we have a deep, floating, slow, rapid, empty, and full. So for deep, we also have firm when we palpate the pulse, which could also be hidden. So yung mga hindi basta nararamdaman na pulso, this could also mean a deep pulse. So for floating pulses, we could also say they could be hollow or leathery. For slow pulse, they could be generally slow, or we could also feel they are knotted through palpating. Rapid pulses could also be felt as hasty, hurried, or moving. For empty pulses, we could feel they are weak, they could be fine, minute, soggy, short, or scattered. While full pulses could be also felt as overflowing, wiry, tight, or long. Okay. So we also do pulse diagnosis relating to the 8 principles. So for exterior or young syndromes, we generally could see or feel a superficial pulse, which during palpation, we will feel it with light pressure. We can feel the pulse with light pressure. So for a specific pulse quality, this pulse is superficial, floating, hollow, or leather-like, or leathery, or soft. So for interior or yin patterns, the general pulse quality will be deep. And this pulse through palpation can be felt with deep pressure. So for a specific pulse quality, this pulse are deep or could be firm, could be said to be hidden. For hot or young syndromes, generally the pulse quality is rapid. To describe this pulse, we usually have more than 80 beats per minute or more than 5 beats per breath. So we can describe this pulse as rapid, hasty, or moving. For cold or yin syndrome, we usually can palpate a slow pulse, meaning pulse lesser than 65 beats per minute or lesser than 3 per breath. This is a slow, tight, knotted, or intermittent pulse. Not necessarily slow, but often yung intermittent na sinasabi. So, kung walang definite na rhythm, kumbaga, paiba-iba. So for full or young conditions, this generally the pulse should be full. To describe this, these are large, long, and substantial pulses. For the pulse quality, they could be big, overflowing, wiry, tight, long, slippery, or flooding. So talagang ano siya, full na full. In contrast, we also have the empty or the yin pulse. So to describe this empty pulse, we have small, short, or insubstantial pulses. Quality-wise, we could say that we can feel there is a weak, fine, minute, short, and scattered or choppy pulse. So that's all for today about palpation. Join us again for the other topics on the palpation or diagnosis through palpation. Thank you for listening.
Thank you very much, Ma'am Lynn. Now let's go to the wood element. We are still on the concept. We have here an example, a case of dysmenorrhea at the onset of menstruation. So treatment, we use the luo point of the gallbladder 37, to prevent the blood from stagnating, because we would want to move the blood. Bladder 18, the Bakshu point of the liver, to improve the function. Spleen 8, which is a symptomatic point for dysmenorrhea. Stomach 40, the Lu connecting point of the stomach, which is a symptomatic point to improve circulation. Li4, which is called the great eliminator, helps in the releasing of blood. The patient should be treated for 3 to 4 sessions monthly during the middle 10 days of the menstrual cycle for 3 months. No treatment is done during the menstruation. The liver secretes bile. The body needs bile in order to digest fatty foods. During hepatitis, the liver yang is high, and the patient suffers with high bilirubin, jaundice, nausea, itchy skin. When liver yang or liver qi is deficient, there is insufficient bile secretion, and patients are unable to digest fats and milk products. They have bloating of the upper abdomen, belching, and have yellowish-green colored semi-solid stools with much wind after consuming these foods. Bitter foods helps to stimulate the bile secretion. Hence, an espresso or schnapps after a heavy meal aids digestion. Liver generates interior wind. We depend on exterior wind to move energy around in enclosed environments. If not, it could get quite stuffy. Patients often talk of headaches that clear in the fresh air and skin ailments that improve on breezy beaches. When it is not possible for us to be in the windy outdoors, our energy, blood, and body fluid depend on the wind in the interior of our body. So this is the interior wind to move them. The liver qi generates this interior wind. When liver qi is deficient or depressed, the energy fluid or blood tends to stagnate in different parts of the body. Energy blocks such as frog in throat, fullness in upper abdomen, emotional frustration with unvented anger, rigid movements as in Parkinson's disease or mental depression, fluid blocks such as hydrocele, localized cold edema, blood blocks such as varicose veins and varicocele are some examples of blocks caused by liver qi deficiency. The most effective method to improve the functional qi of the liver is to do sports or regular exercise. Exercises that move the entire body without overexertion, like Qigong or Tai Chi, are appropriate. It is also good to avoid fatty foods and milk products because this thicken the blood and fluid in the body, thus making them flow slower. Foods beneficial to liver qi are foods at the beginning of their life. As food element is associated with the direction east and to the time of birth in the 5 phases of life, all foods at the beginning of their life have more wood yang qi. Sprouting beans, alfalfa sprouts, a day-old chicken, young animals and birds are good for improving liver qi, provided they are cooked without thick, creamy sauces. Light pastel green color used in a room where most emotional blocks are suffered is a simple therapy. Acupuncture points for liver qi deficiency are Bakshu and Luo point of the yang organ, bladder 18 and GB37, Shu point improves the function. Qi deficiency causes stagnations, and the Luo point of the yang organ will circulate or release the stagnation. Less wind causes stagnations and blocks. Excessive wind causes excess movement and irritation. These are called wind symptoms. Thank you very much for your attention. We shall now call back Ma'am Lynn Galarita for her topic on menstruation. Good afternoon ulit, Ma'am Lynn.
Good afternoon ulit. So today we continue our discussion on the different treatments, on the different problems related to menstruation. So let's start today with liver blood deficiency. This problem can be treated using the acupuncture points REN 14, UB 15, the front mu and backshoe points of the heart. So after 3 sessions, these points are substituted by heart 9 and SI3, or these are the tonification points. So another point we should also use is bladder 17, which is the influential point for blood. Another point is spleen 10, or the sea of blood, and gallbladder 39, which is the influential point for the marrow. Points for liver blood deficiency are points to nourish and synthesize blood. And as heart makes blood, the tonification points of heart and small intestine are used here. The influential points of marrow is used because bone marrow makes blood. Okay. So for liver and urinary bladder, or in TCM, the uterus, the uterus in TCM is the urinary bladder. For the blood stagnation in these organs, we use bladder 18 and bladder 28, the backshoe points of the liver and the urinary bladder to improve function. We also use GB37 and bladder 58, the loop connecting points of the gallbladder and the urinary bladder to sedate yin and tonify the yang. Another point we could use is LI4. This point is the great eliminator. This helps in bleeding and removes stagnation. We could also do paravertebral tapping with plum blossom needle from lumbar 4 to sacrum 4. This is 1 centimeter lateral to the midline, vertically from top to bottom until red skin reaction. Okay. For spleen qi, deficiency. Since this is against spotting of blood, only 1 point is needed. So we can moxa spleen 1 with spiral pecking method. And this could be done on both feet for about 6 minutes. So for kidney yin and yang deficiency, we could also use REN 3 and bladder 28, the front new and back points of the urinary bladder, in kidney 7 and bladder 67, the tonification points, also spleen 6 and stomach 36 to tonify organs of the earth element. So for liver yin and yang deficiency, we use liver 14, bladder 18, the mu and shu points of the liver. This point should be replaced after 3 sessions by liver 8 and gallbladder 43 as tonification points. These points are also, we could also use the symptomatic points for dysmenorrhea. We could also use spleen 8 and spleen 6. If kidney and liver are both yin and yang deficient, it would be sufficient to concentrate on tonifying the kidneys. As the mother organ, it would then nourish the liver. Okay. Thank you for listening.
Thank you very much, Ma'am Lynn.
Okay.
Next, we bring you metal element, and this will be presented by Ma'am Teresita Sumile of Rizal. Good afternoon, Ma'am Teresita.
Good afternoon po, Doc. Good afternoon, everyone. The metal element, the concept. Lung ascends and descends water. It is said that we have 3 lungs, that is, our 2 lungs and the skin making up the 3rd lung. The lung has to irrigate all of this. It is in order to do so that it has to both ascend and descend water. Lung opens to nose, senses smell, secretes mucus. The nose is the doorway to the respiratory system. The nose, the sinuses, the pharynx, and the trachea are all lung territory. A problem in any of these areas should be treated as a lung imbalance. Inflammation of the upper respiratory tract with pain, sneezing, hot head, and colored mucus is a yang dominant state, whereas a blocked nose, excessive white mucus, heavy head, and coldness is a yin state. A good sense of smell indicates healthy function. Acute anosmia could be a yin excess symptom when we get a common cold with a blocked nose and excess mucus. We lose our sense of smell. But if the anosmia is chronic, then it is more likely to be from qi deficiency. If the yin and yang are both deficient, the patient cannot smell well at all, but often complains of an unpleasant smell around them. Okay? Lung secretes mucus. Excessive mucus is a sign of dampness. Even though lung secretes its own mucus, the organ that generates and circulates is the spleen. Damp-producing foods such as milk products, fatty foods, refined sweets, and cold raw foods can create dampness in the spleen and flow to lung, the sun organ. Point of stomach 40 should be given in order to circulate the stagnant dampness in the lung. If there is dryness of the mucous membranes or very thick mucus, this will be because of yin deficiency, and the patient should be encouraged to drink water and humidify the living rooms to improve the yin. Okay? Common cold. A common cold is generally an acute excess state. It is generally described as a wind invasion of the upper respiratory system. causing systems from nose to pharynx. There may be a headache and feeling hot or cold in the exterior, aversion to wind and sweating, much or not at all. This is caused by the exterior wind attacking the interior and irritating the nose and throat. When the immune system is good, the patient will usually return to normal health the next day after an early night. But it is also possible that the patient wakes up the next morning feeling worse than the day before. If the symptoms will deeper and the voice changes, this is the point when the exterior disease changes to an interior disease. Until the point of moving to the interior, wind invasion of the upper respiratory tract can be treated with one session of treatment and the pathogenic factor eliminated. The main purposes of the treatment are to get the patient back to normal health as quickly as possible and not to let the pathogenic factor get to the interior and cause a long-term chest infection. Table 12.2 Point 12.2 to help you differentiate between the wind cold and wind heat types of common cold, sinusitis and pharyngitis. Now let's go to common cold. Wind cold invasion of lung, there is yen excess. So symptoms are blocked nose alternating with running nose, few sneezes, cold aversion to cold throat, mucus tends to be white, less thirst, prefers hot drinks, stools and urine lighter than usual, more watery or semi-solid. Tongue is white, thin white coating, and the pulse is superficial, wiry, and slow. In wind heat invasion of lung, the lung is in excess state. Much sneezing, some runny nose, hot head wants to keep its cool body, could be normal or cold. Mucus, more yellow or dry. Much thirst, prefers cool drinks. Stools and urine darker than usual, more hard. Tongue is thin yellow coating. Pulse is superficial, wiry, and rapid. Treatment in wind cold invasion of lung, local, extra 1, Yentang, Li20, Si17, distal, Li4. Symptomatic point, stomach 40 for mucus, energy points, lung 6 or lung 5 sedation, Shickliff or sedation point. Gallbladder 20, wind elimination tonification. Now, in wind heat invasion of lung, treatment are the following. Local, distal, symptomatic, same as left. Then energy, lung 6 or Li2 sedation, Shickliff or coupled organ sedation, GB20, wind elimination sedation, and lung 11, bleeding releases heat. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We call once again Ma'am Lynn Galarita for the Chi, part 4.
Good afternoon ulit.
Ganun po ulit.
So today we continue our today we talk about chi disharmonies. Chi has 4 main states of imbalance. These imbalances may affect many parts of the body at once or within a particular meridian, organ, or area. Deficiency of qi, for example, may affect the lungs with symptoms of shortness of breath, the spleen, stomach and spleen with symptoms such as poor appetite, and the body in general with symptoms of fatigue and weakness. In qi deficiency, because of overwork, mental strain, weak constitution, if there is weight deficiency, we often gets cold easily or flu easily. The problem become chronic, especially in old people. Organs involved usually the spleen, the lung, and the kidney. Clinical manifestations for qi deficiency
Ka pa, Doc, o sa clinical? Clinical manifestations, fatigue, shortness of breath, pale face, weak spirit, excessive sweating, tiredness, lethargy, apathy, exhaustion, disillusionment, dislike to speak, spontaneous sweating, all made worse with exertion or exercise. The tongue is pale. The tongue has pale body with thin coating, and the pulse is empty. Sinking qi. If qi is very deficiency, then the holding function is depleted, and it may sink, organ prolapse, especially spleen qi. Clinical manifestations, down-bearing sensation in abdomen or prolapse of organs. Tongue has pale body with thin coating, and the pulse is empty. Rebellious qi. In this instance, qi flows in the wrong direction. Example, stomach qi considered to flow downwards, carrying food to the intestines. If qi rebels, it will move upwards, leading problems, especially stomach qi. Clinical manifestations are coughing, belching, vomiting, hiccups, and dizziness. Tongue has pale body with white coating or red with yellow coating. The pulse is wiry or rapid.
Okay, so in qi stagnation, there are long-term causes. Could be irregular eating habits, stress, premenstrual syndrome, and painful periods. These commonly in acute conditions. These are commonly seen in acute conditions like cold or flu, attacking the flow of qi, causing emotional shock. This is when the qi gets stuck and stop moving. You see this mostly in liver qi. Okay. So for the clinical manifestations of qi stagnation, we have normally some include some sort of pain or distension or stuck feeling. Example, distension or dull pain in the hypochondrium and chest, pain that is not fixed in the chest or hypochondriac areas, sighing, hiccup, abdominal distension, fluctuation of mental state, feeling of difficulty in swallowing, melancholy, moodiness, unhappiness, feeling of lump in throat, painful periods, distension of breasts before periods, premenstrual tension, and irritability. The tongue will be normal, while the pulse will be wiry or tight. That's all for today. Thank you for your attention.
Thank you very much, Ma'am Lynn. Let's have Ma'am Teresita Sumile once again, this time for the water element. Good afternoon ulit, Ma'am Teresita.
Good afternoon ulit, Doc Heck, and good afternoon, everyone. Water element menstruation. Now let's talk about the kidney. The kidney has two mothers. The Mingmen, that, okay na, Doc? The two kidney functions can be diagnosed on two different pulse positions as well. The water kidney can be felt on the right wrist proximal position and the reproductive kidney on the left wrist proximal position. Therefore, these two pulse qualities may not necessarily be identical at any one time because they are indicative of different functions of the kidneys. Puberty. According to traditional Chinese medicine, the average age for male puberty is 8 times 2 equals 16. So we have 8 yearly periods being the number of the life cycles in a man. And the average age for a female is 7 times 2 equals 14. So there is 7 yearly periods being the number of life cycles of a woman. Delayed puberty would mean that the reproductive kidney is young deficient at the time, and this should not be point for consideration of the kidney status should we treat the patient at a much later date. Early puberty would be kidney young excess, again only during that period. After puberty, all functions of the reproductive system like menstruation, libido, and fertility are all manifestations of the kidney yang and qi, while yin and blood often offer nutrition, stability, and endurance. Now let's talk about menstruation. The menstrual cycle is a release of heat and dampness from the uterus. The uterus is directly associated with the urinary bladder, and the diagram below illustrates this clearly. Okay, so tingnan na lang po ninyo. Okay, then an average menstrual cycle is 28 to 32 days, and the average bleeding period is 4 to 5 days. The bleeding should be heavier on the first 2 days and then reduced to stop by latest in the 5th day. As you see in the diagram above, both the heat as in blood and dampness as in fluid are released in these days. And at the end of the menstrual bleeding, both blood and fluid are low. Okay? There is a dramatic fall in the estrogen and progesterone levels during the time of menstruation. The cycle starts again after this drop in the hormones. The follicular phase of the menstrual cycle begins with the pituitary gland secreting the follicle-stimulating hormone. This stimulates the follicles on the ovary to produce eggs. At the same time, the estrogen levels begin to rise. The body temperature starts to increase, and at the high point of this increase, the mature egg is released. This is so far the young dominant phase of the cycle and the estrogen phase. The yin has been increasing at a slower rate until then, but now the yin starts to rise. As the luteal phase begins, fertile alkaline mucus is secreted on the cervix, and endometrium prepares itself for the fertilized egg to travel down the fallopian tube and implants on the endometrium. It increases its secretions, blood circulation, and thickness. This is when the corpus luteum produces progesterone, and it is the progesterone phase. Okay? In the first half of the cycle, the young is on the increase. Ovulation occurs during the time the heat is at its highest rise. This heat is important for fertilization to occur. Some women have problems becoming pregnant even though they ovulate and menstruate quite normally. This could simply be because their body temperature is too low at the time of ovulation. Okay? The author have found this to be true in many of his patients. When we regulate the body temperature with acupuncture, exercise, and diet, they become pregnant without any medication. In the second half of the cycle, dampness and yin are on the increase. If fertilization had occurred, this dampness and yin are needed to keep and nourish the fetus. The yang or heat continues to be maintained by the blood and fluid. In some women with kidney and urinary bladder yin and blood deficiency, the endometrium stays thin and undernourished. This may cause habitual miscarriages or stillbirth. However, if the woman does not conceive, then both the heat and the dampness break down and the next period starts. There should be about 14 days between the ovulation and the bleeding. In some cases, when there is kidney yin deficiency, the yang may rise earlier than usual. These women are more likely to have shorter menstrual cycle because the kidney yang rises earlier and bleeding occurs sooner. Or it is possible that the ovulation is delayed in those who have a deficiency in kidney yang, and that causes a long menstrual cycle. So the first illustration is a short cycle caused by early ovulation. Kidney yang rises earlier because of yin deficiency. And the next illustration, this is late ovulation in kidney yang deficiency causes a longer cycle. Okay po? Now treatment, short menstrual cycle. Kidney 4, the loop point tonifies yin and sedates yang. Ren 3, move front of urinary bladder tonifies yin. Spleen 6, area distal point for the reproductive organs. And UB40, earth point, grandmother point, tonifies yin of urinary bladder. Treat from day of menstruation or as soon as possible, twice weekly. 3 to 4 sessions per month. There is no treatment closer to the period. Treat for 3 or to 4 months in all. Now let's go to long menstrual cycles. Treatment, Ren 3, Moxa only, local warming. UB23, the Bakshu point of kidney, it tonifies yang. And UB28, the Bakshu point of the urinary bladder, tonifies yang. Kidney 3, the earth element and the grandmother point tonifies kidney yang. And UB67, tonification point, which tonifies mostly yang. Treat from 6th to the 14th day of the cycle. There are 3 to 4 times in all. The patient should call after the period begins to make the appointments for treatment. The purpose is to advance the ovulation, so the treatment should end by the expected date of ovulation. Repeat monthly for up to 4 months. Then the same points are used at the same time of the cycle and the treatment of infertility, as we need to increase the young to facilitate fertilization. Okay? Infertility, habitual abortion. So it is illustrated here how infertility or habitual abortion because the second phase is yin blood deficient. So the second phase of the menstrual cycle, the progesterone or the luteal phase, is mainly when the blood and dump increase to stabilize the fertilized egg in the endometrium, and thickening of the endometrium and proliferation of the blood vessels occur. This stage will break down if the yin and dump are deficient. This can cause two problems. One is habitual abortions and very early pregnancy. And second, maybe stillbirth in later pregnancy. Women with Guinean or blood deficiency tend to have a shorter second phase. So the next illustration, it is an excess of dampness and maybe blood stagnation. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We call once again Ma'am Lynn Galarita for the next presentation. Good afternoon, Ma'am Lynn ulit.
Good afternoon, Doc. Good afternoon, everyone. So we continue our discussion on the extra meridians. For today, we discuss about the due meridian. The due meridian has the SI3 as its confluent point. This meridian is the most young meridian of the body. It is the back midline meridian, so along the spinal column. It is often used for any problems along the center of the back, such as back or neck pain, coccyx or inflammation, scoliosis, and kyphosis. The posture of the back is determined by the young in the due meridian. If the young was deficient, then the back would hunch forward, as in osteoporosis patients, in depression, and those with Parkinson's disease. This would cause pain in the back and problems of the internal organs in this region, as they are squashed into a smaller space. Asthma, fullness of stomach, and reflux of food and acid, palpitation, and angina pectoris are some of the possible symptoms. In this case, one could consider moxibustion on the due meridian in order to strengthen the back and improve posture. Okay. So how do we apply moxa or use moxa on the due meridian? A moxa cigar is lit and held at 1 to 2 centimeters, 2 centimeters distance from the skin, moving from the 5th thoracic vertebral prominence towards the posterior hairline. This is repeated several times until there is a red skin reaction. This is an effective treatment for both the pain and the interior organ symptoms, and can be considered in osteoporosis patients for prevention of kyphosis. It would be also good for treating patients with back pain when bending forward, and the area of the due moxa could be moved according to the area of pain in the back. When there is back pain on extending the back, this is a young dominant pain on the due meridian. This could be treated with sedation of due meridians in acute and subacute states with vibration of point SI1, the confluent point of the meridian, and in subacute and chronic states the yin aspect of the Du meridian needs to be tonified as well. This could be achieved by placing some needles on Ren meridian just opposite the area where the back pain is. The Ren meridian is the coupled yin meridian of the Du meridian, and treating the anterior aspect of the Du meridian would tonify its yin. Okay. The second use of the meridian is to influence the general yang of the body. It is used in yang deficiency in 3 elements or more at the same time. To tonify the Du meridian would be a simpler way to improve the general yang of the body with fewer points but greater effect. In order to tonify the Du meridian, it is necessary to use the confluent point of the meridian, which is SI3, and some points of the Du channel itself. This is because point SI3 is also the tonification point of the small intestine meridian, and we need to give a clear message to the body that this time it is the Du meridian we wish to tonify. The 3 points chosen on the Du meridian should ideally be on the upper, middle, and lower back. For example, Du 4, Du 11, and Du 14. This treatment method may be simple, but the effect is very strong. Care should be taken that these treatments are not repeated too often like other points. After using the initial points 3 or 4 times, it may be better to stop tonifying the meridian and go on to tonify the weakest yang meridian. Sedation of the meridian can be used to sedate the yang excess in 3 or more elements. This is done by sedating points SI3 only, without the use of other points on the meridian. This is a very quick and efficient method to sedate extreme yang states such as mania, hyperactivity, heat, or urticaria. So that's all for the Du meridian. Thank you for listening.
Thank you very much, Ma'am Lynn, for the presentation on the Du meridian. Okay, we come now to the last topic, still on chronic fatigue syndrome, the Chinese concept. Another factor that may draw latent heat towards the surface is emotional stress, especially when this affects the liver and causes heat. So it may pull the latent heat outward. So bawal ma-stress. So latent heat occurs when an individual suffers an invasion of exterior wind without developing immediate symptoms, and the pathogenic factor goes into the interior where it turns into heat and comes out months later. The underlying reason for this is usually a kidney deficiency. If the body condition and the kidneys are relatively good, a person will develop symptoms at the time of invasion of external wind. So this is a healthy reaction. If the kidneys are weakened by overwork and excessive sexual activity, the body's qi is too weak even to respond to the invading external wind. This causes the wind to penetrate into the interior without the person developing exterior symptoms. Once in the interior, it incubates and turns into heat to come out some months later. The ancient doctors believe, in particular, that if the essence is properly guarded and not dissipated, pathogenic factors will not enter the body and latent heat will not develop. The simple questions in chapter 4 says, the essence is the root of the body. If it is guarded and stored, latent heat will not appear in springtime. In winter, cold attacks. In spring, heat attacks. Latent heat is also called spring heat. This concept is very important in practice as it implies that resistance to pathogenic factors does not depend only on lung qi. which influences defensive qi, but also on kidney qi and kidney essence. In fact, defensive qi is spread by the lungs, but its root is in the kidneys, specifically the kidney yang. In chronic recurrent infections like chronic fatigue syndrome, kidney qi is often very deficient, leading to decreased immune response. Another possible cause of latent heat can be immunizations. When attenuated or inert forms of certain pathogenic organisms are injected into the body, bypassing the body's first line of resistance. From a Chinese medical perspective, it is as if an external pathogenic factor penetrated the body's interior directly, completely bypassing the exterior levels. This is exactly what happens with latent heat. Okay, so we're going to take a look at the figure, the illustration later, which is based on Shepard's view of the etiology and pathology of chronic fatigue syndrome. We can see the similarities with the Chinese view of chronic fatigue syndrome. So the virus persists, that's residual pathogenic factor. The virus reactivated, equivalent to latent heat. Inadequate immune response, kidney deficiency. So if, let's say we get the virus, so there are cofactors that will influence it. So the age, your stress, and your female genetic, and also an inadequate immune response. So the virus will persist, and therefore you will have poor memory and concentration affecting the brain. Or the virus can be reactivated. So this will go to the muscles. So the muscles will ache, you will have fatigue and heaviness. To summarize, the two conditions that can lead to CFS can be illustrated with a diagram. So in both the above conditions, the underlying cause is overexertion and lack of adequate rest. It is important to understand the causes of this condition so that we can advise patients accordingly. Most people have no idea that special precautions should be taken during and after an invasion of an exterior pathogenic factor. So this is the illustration that we were talking about, the summary of two conditions leading to chronic fatigue syndrome, the residual pathogenic factor and latent heat. So the external wind, which can be in the form of bacteria or virus, okay, it may cause either an immediate infection or it does not cause an immediate infection. If it causes an immediate infection, the infection appears to go, but it persists. So you form a residual pathogenic factor, and which can weaken the qi. So you'll have qi deficiency. If you have a pre-existing qi deficiency or a comorbidity, this will lead to the pathogenic factor. So this will welcome the pathogenic factor with open hands, with open arms. So another route would be the external wind not causing an immediate infection. So the pathogenic factor this time will incubate inside to emerge later in the form of latent heat. So latent heat will definitely injure the yin. So you will have yin deficiency or even qi deficiency. And if you have a qi and yin deficiency, if this is pre-existing, if these are pre-existing, so this will lead to heat. Therefore, you'll have latent heat. Thank you very much for joining. We hope that you can join us again in the next presentation. Thank you.